Fox 56 News Chief Medical Contributor Dr. Ryan Stanton is with us in studio.
This morning, he's focusing on an outbreak that's being seen across multiple states.
Yeah, unfortunately, as a physician, you can't always be bringing good news to the airwaves. And
in fact, you rarely do.
Very rarely do. You don't need an emergency physician because things are going great.
Yeah,
so this is actually another situation, but hopefully something that people can use to maybe decrease that risk as they travel out and about for the summer. As federal and state health officials are investigating a multi-state outbreak of cyclosporiasis with hundreds of confirmed cases and rising. The infection is caused by the microscopic parasite Cyclosporiasis and is most commonly spread by consuming fresh produce or water contaminated with human fecal matter. Past outbreaks have been linked to foods such as cilantro, basil, leafy greens, raspberries, and green onions, although investigators at this point have not yet identified a single source for this current outbreak. Symptoms usually begin about 1 week after exposure and include prolonged watery explosive diarrhea, along with loss of appetite, nausea, abdominal cramping, bloating, fatigue, and low-grade fever. Without treatment, symptoms can last for weeks and may come and go, increasing the risk of dehydration, especially in children and older adults. People with weakened immune system are especially at risk. If you develop persistent diarrhea, especially after eating fresh produce, contact your healthcare provider. Diagnosis requires a specialized stool test, and the infection is typically treated with an antibiotic along with aggressive hydration. Thoroughly washing produce, practicing good hand hygiene, and staying informed about food recalls may be the best way to reduce your risk while investigators work to identify the source of this current outbreak. So, you know, I don't like coming on TV and talking about GI distress, but at the same time, this is huge. In Michigan, this weekend, quadrupled the number of cases they're reporting. So 18 states are involved right now. Kentucky is not currently one of them that's listed, but it is expanding very quickly. And since we don't know exactly what the source is so far, this is important to be aware, extra hygiene, take care of yourself, and you get symptoms, get checked out.
Do you have a product that you recommend when it comes to cleaning your fruits and vegetables?
One of the best things for preventing is just good old-fashioned running water. There are a lot of things out there that are natural, that are good for cleaning vegetables, but just plenty of running water, especially if it's conditioned or municipal water, is a way to go. It's one of the sources. Sometimes is a well water.
So we don't need to be putting dish soap on it.
I definitely wouldn't use dish soap. You can use something such as a vinegar. There's some of those commercial sprays that are available. Make sure it's one that's natural, though, if you're going to do it. Don't make sure you're not exposing yourself to other types of chemicals. But be careful. I was actually in the Detroit airport yesterday and saw a person cleaning the tongs with their hands, the ends that's supposed to be on the food, and then saw another person picking up cheese, looking at it, and putting it back for the rest of us, and then grabbing another one. So just remember, not everybody cares about your health as much as you should, so take care of yourself.
Will we see you again this morning?
Yes, I'm coming up, and it actually is a good story because we're going to talk about how exercise can be linked to brain health as we age.
Oh, wow. I'm all ears on that one. Thank you.
It's coming.
That's great. All right, Dr. Ryan Stanton, the doc is out for now.